Now we're going to begin part 3 of Peds Dermatology. We're going to discuss a variety of conditions that none of you would really like to have, and some of you may have suffered these as a child. We begin with impetigo. What this is a group A beta hemolytic strep infection, and it's also known as a superficial pyoderma because it is only on the surface of the skin. When you look at the lesions that are on the right, you can see that they are what we call papulovesicular. So you have some of the raised erythematous areas that are just solid, while others have little vesicles that are full of fluid, and they are highly contagious. Eventually, these lesions coalesce, meaning they come together, and they become one large golden crusted weepy lesion, and the crust tends to be yellow. Impetigo can cause an acute post-streptococcal glomerulonephritis. When we're taking care of these lesions, we want to soak the crusts with warm water, and we bathe with an antibacterial soap. We treat small lesions with mupirocin, which is known as Bactroban, that's the trade name, cream. But for extensive areas, they get treated with oral erythromycin. And some may actually have to be admitted, and we take care of these kids and give them IV antibiotics. They will be on contact isolation, and so you need to consider this when you're determining where this child will be admitted and in terms of what room and who will the roommate be. Hand washing is very essential to decreasing the transmission if this child is not admitted to the hospital. It is recommended that these children stay home from school for 24 to 48 hours after initiation of oral antibiotics and 48 hours after topical antibiotics. Now we're going to talk about lice. And you're probably going to start scratching as I talk about this. So lice occurs in young school-aged children primarily. It tends to be in Caucasians and in females most commonly. Why? Because these girls are sharing all the products that they have for their hairbrush, their comb, their barrettes, their headbands, whatever. A louse can live in the hair or on clothing, and it intermittently is going to feed on the host. And you can see these little guys are just clinging right on that piece of hair. And so you literally can see the louse and the nits. We treat these with permethrin, 1% shampoo, and then we can also use lotion because they can go even on the eyebrows. I remember a guy coming into the clinic, and he looked at our clerk, who was just the intake person, and said, "I think I have a problem and I need to see somebody." And he had lice that were clinging on his eyelashes and his eyebrows. And our clerk came into the back and said, "I got somebody out there that needs a room right away." In which case, absolutely, you're going to take this patient and you are going to put him in a room and you're going to put him in isolation because you do not want to get this. Back to treatment. We're going to give this shampoo and or lotion. You leave it on for 10 minutes and then it gets washed off. And it is now recommended that they retreat on day 9 and again on day 18 if the parents are still seeing little nits. And the nits are those little white eggs that are sitting on those hair follicles in the middle picture. In addition to using the shampoo, the parents need to comb the hair with a nit comb. It's a very fine tooth metal comb, and then wash it off. Other family members should be checked and treated as needed. In addition, you need to teach the parents and the child, if they're old enough, that they have to wash the bedding and the clothes that have been used within the past 2 days. And we wash them in very hot water, wash the combs, and vacuum the carpets. If there are non-washable products that could be affected, and that would be like stuffed animals, Those can be put in a bag that's well sealed, and they need to remain there for a good 2 weeks, and then the lice will die. Now, the most current recommendations, and this is from May of 2015, the American Academy of Pediatrics does not recommend that these children stay out of school just because they have lice. Next, we're going to talk about scabies. And this is the most common parasite known to man. And what it is a little mite that mates. After mating, the male dies, and the female ends up burrowing into the skin, and it lays eggs. These eggs mature within 10 to 14 days. And so there may be a delay in symptoms by as much as 3 to 4 weeks. So sometimes you have no idea where did somebody get these scabies. So the signs and symptoms of scabies is they're complaining of severe intermittent itching. And most of the time, this itching is worse during the night. So you need to do a quick look at where scabies like to hang out. They like to hang out in the axilla, around the umbilicus, in the groin, in the web spaces of the fingers, as well as between the toes. And then on infants, you need to look at their scalp and their face, and they can even get it on their hands, as you can see in the middle picture. So you need to do a quick inspection. This is another thing that is highly contagious, and if you think they have scabies, you get them in a room and you put them on contact isolation. We treat scabies with a 5% permethrin cream, and this is called Elamite. That's the brand name, and this is an over-the-counter product. They need to apply it to the body and the head, but avoid the eyes and the mouth. Be sure the babies have long sleeve clothes on so they're not putting their extremities in their mouth. And put mitts on the hands. They keep this cream on for 8 to 14 hours. It may need to be reapplied in 1 week. If the topical is not effective, ivermectin, 200 micrograms per kilogram, given times 1, and then repeated in 14 days, may be indicated. The education that's required for scabies is similar to that of lice, in that you wash all the clothes and bedding and stuffed animals in 140-degree water. That's pretty hot. And dry everything in a hot dryer. Once again, bag the belongings that are not washable for at least 72 hours. Less than what's required for lice. Usually the whole family ends up being treated at the same time. And do remind the parents and the child that itching is common and can persist for up to 2 weeks after treatment, and it doesn't indicate that they have to be retreated. Now our next little bugger is called pinworms, enterobiasis. This is an intestinal parasite. So you can see on the left the pattern of how this organism replicates. So we swallow the eggs, they grow and reproduce in the colon and the rectum. And then the little worms come out of the anus during the nighttime. They wiggle around and they cause a lot of itching. And that's what the parents bring them in with. This kid is screaming and crying during the night and saying, "My butt itches." Of course, the parents look and they're like, "Well, I don't see anything," but they're not looking the way we look. How do we diagnose it? Well, we have to do a careful assessment, which means that you need to look at the anus. And so during the daytime, what we'll do is turn out the lights, and you need to spread the buttock cheek, and we open up the anus a little bit and we can see the worms. But another more common way that we do it is we actually put a piece of Scotch tape across the anus when the kid is going to bed. And then this is taken off in the morning, and then we'll look at it under the microscope and we can see the pinworms. The physician or nurse practitioner may also scrape under the fingernails and look for eggs. We treat this with a one-time dose once a week for 2 to 3 weeks with mebendazole, or parental palmoate, which that's a difficult one to say. I like to use the over-the-counter. Pinrid, far easier. We can also use the albendazole. Our parent education regarding pinworms is hand washing is essential. They need to wash the bedding and the stuffed animals similar to the lice and the scabies. This kid needs to keep their fingers out of the mouth. No biting of the nails. And if more than one family member is affected, the whole family needs to be treated. And this ends the lecture about Peds Dermatology.